ShinyHunters claims 8.8 bin medical breach as Amazon-owned clinic faces dual incidents. We audited their email security, and the scores are concerning. One Medical was in the news as we scanned their domain. One Medical at onemedical.com scored 71%, rated good. The ShinyHunters claim against One Medical, Amazon-owned primary care provider, One Medical, is currently under intense scrutiny following a significant claim by the extortion group ShinyHunters. The group alleges they have stolen an astounding 8.8 terabytes of company data and have issued a deadline of June 22, 2026 for negotiations, threatening to publish the information if their demands are not met. This claim, while unverified by sample files, is a serious allegation given ShinyHunters' history of data theft and public leak pressure tactics across various sectors including technology, retail, and government. If legitimate, this exfiltrated data could contain a dangerous mix of medical and personal identifiers, making it a goldmine for identity fraud and sophisticated phishing attacks. One Medical operates over 250 clinics and virtual care services nationwide, meaning a breach of this magnitude could impact a vast number of patients. A separate, confirmed incident. Legacy Iora health data. Adding to One Medical's security challenges, the company has also disclosed a distinct security incident. This confirmed event involved a third-party file storage system used to retain archived information specifically from legacy Iora health patients. Fierce Healthcare reported on the seniors' focused disclosure as a separate, confirmed event, distinct from the unverified ShinyHunters claim. This highlights a critical aspect of cybersecurity. Even if primary systems are secure, vulnerabilities can exist in third-party vendors or legacy data archives. It underscores the complexity of securing an organization, especially one that has grown through acquisitions and integrates various systems and data storage solutions. Understanding EmailMano's domain audit scores. At EmailMano, our domain audit scores provide an independent, public domain assessment of a company's email security posture. When we audit a domain like onemedical.com, we're primarily looking at configurations for SB, DKIM, and DMARC. SPF, or Sender Policy Framework, helps prevent email spoofing by specifying which mail servers are authorized to send email for a domain. DKIM, Demake's identified mail, adds a digital signature to outgoing emails, allowing recipients to verify that the email was sent by the domain owner and hasn't been tampered with. DMARC, Domain-Based Message Authentication, reporting and conformance, builds on SPF and a DKIM, telling receiving mail servers what to do with emails that fail authentication, whether to quarantine them, reject them, or simply monitor them. These scores reflect how well domain is protected against email-based threats like phishing and spoofing, which are often precursors to larger breaches. What our scores do and do not measure. It's crucial to understand what our audit scores measure and what they do not. A strong SB, DKIM, and DMARC score indicates a robust defense against email impersonation and phishing attempts originating from that specific domain. However, these scores do not measure internal network security, employee training, physical security, or the security of third-party vendors and legacy systems. For example, a passing public domain score does not rule out compromise via third-party storage, as seen with the legacy Iora Health Archives incident or through social engineering tactics. Our audit focuses on the public-facing domain's email security configuration, not the entirety of an organization's cybersecurity infrastructure. Therefore, while a good score is a positive indicator, it's not a substitute for comprehensive internal and vendor security controls. One Medical's domain posture. A closer look. An EmailMano cybersecurity audit of onemedical.com on June 19, 2026 scored the primary patient-facing domain at 76%, which we categorize as good. This score is stronger than many healthcare targets we've tracked in our 2026 Washington and Texas Ag reports. This suggests that One Medical has a reasonably strong defense against email spoofing and phishing attempts directly targeting their main domain. However, as we've discussed, this score does not encompass the vulnerabilities that led to the confirmed incident involving the third-party file storage system for legacy Iora health patients. The confirmed seniors incident involved a separate file storage environment, not necessarily the main marketing site, illustrating that even a good public domain score doesn't guarantee immunity from all types of breaches, especially those involving external systems or archived data. This content is for informational purposes only and is not legal advice. Our audit provides an independent public domain assessment of email security configuration, SPKIM, and does not reflect internal network security, vendor security, or other aspects of an organization's overall cybersecurity posture. What company or domain should we scan next? Let us know in the comments below.